Hafsa, I don't know if you've met Fidel. He's one of our surgical residents who is going to join us starting next summer, not this summer, but next summer for the next 2 years. For the surgical residents in training, they take 1 to 2 years to do research time. And they have to be planned out years in advance just for clinical staffing purposes. For this next year, we have a research resident who we're going to be working with from Medical College of Wisconsin. We haven't connected about him yet. But Fidel will be our Utah resident. And typically we have 1 resident per year. And sometimes that may go up or down depending on the year. And then we probably will have multiple non-Utah residents and fellows working on very specific things. We just have to carve out specific projects for them because we're often the place that runs a lot of different projects, and people are always looking for things to do. So they naturally kind of come to us looking for projects. But yeah, so Fidel is working on resubmitting his proposal for what he should work on. And it's hard to say, like, what are you going to work on 1 year from now? It's like, where are these projects going to be 1 year from now? We don't even know 1 month from now sometimes what's going to happen with these projects. So we're trying to see how to create reasonable sort of expectations both for him and for the department to say, yes, you can have this person because you'll have a reasonable project. So it's a little bit of a trick. But yeah, that's Fidel. I don't know who all is going to be coming on today since it's not we don't have a speaker or anything. So it's just a matter of kind of updating on various projects. Fidel, any comments? I left you a couple of comments on your proposal the other day, and I will work on it some more today. But I think it's due today, right? Or due tomorrow?
Yeah, it's tomorrow, and I just saw them this morning. But yeah, I'm working on them. I actually had a meeting with Dr. Lambert yesterday just for like general residency stuff. And I talked to her about, the proposal, and, I told her that we met and that we've talked about it. And she said that even though the questions seemed pretty specific, that she thought, the answers that we had discussed were pretty reasonable. And that it sounded that we were already like pre-approved somehow. So
yeah. Well, I think it's just that it's they want to make sure that it's real, like that there is real substance behind the project because they're funding you for 2 years, and that's it's department funds, so they want to make sure that really each trainee will actually produce something.
Of course, yes. Mm-hmm.
And it's just having now been in practice for a dozen years and seeing how this research time goes across institutions, it's really tricky to be productive because you get pulled into so many different things. So then it becomes hard to actually generate specific output, which is part of the thing that we're trying to organize and structure so that people can be productive. And productive in a way that counts for them and for whoever their institution is part of, or whoever they're responsible for.
Yeah. No, I completely understand.
Yeah. So yeah. Ray.
Yes. Good. How are you doing?
Haven't seen you in ages.
Yeah, I'm back in town now.
Oh,
I was up there earlier today. I stopped by your office, but you weren't there this morning.
Yeah, Lori. Yeah, I just got in just a little while ago. I had some other things to take care of this morning.
Yeah.
How was the tour of Helix?
Good. I went through there. I mentioned to Aaron that David Ray had thought he'd found a spot for at least one of our TV screens. Looking at the room, I have a wall that certainly would be a spot. I pointed it out, and they're checking to see whether or not it has the electronic ability to support it and whether or not to put there, and then they're going to get back to us. So I thought at least check it. So at our rooms are kind of big enough that if we had a TV in there, we could do a lot of the Zoom meetings with a smaller group, that we don't have to reserve one of those other rooms.
Yeah. Yeah.
Um,
Great.
so we'll see. They're supposed to get back and let us know. You saw, I don't know if you just saw the, so I went through, that's, it's a nice building, and it'll be nice to have everybody in the same spot to be able to have a lot more visibility.
Yeah.
What everyone's doing and what we're doing. And so I think that'll be nice. Obviously, that building's way away from the operating room, so how often people get there will be a different issue.
That's going to be the biggest challenge. But it'll be nice to have workspace that is dedicated. And
I specifically asked where Hafsa's was because they didn't have her on the list.
I can float around. Whoever office is empty, I can just go there, sit there.
Well, part of that is that, when I'm not there every day. So that's something that's a possibility. There are also some other, these cubicle areas they say are not assigned yet. And so they were taking that down, but I wanted to put that in their radar as well.
Thank you.
And I think we probably need more sort of co-working spaces than anything else. I think because all of us are fluid, all of us are here and there, and everywhere. Yeah. That's how it is. And we might have a lot of visitors. Apparently, there's a visitor coming who's going to come from Nigeria to meet with Dr. Noriyaku. And I don't know to what degree they will be involved in, with us necessarily, or maybe we can have them give a talk, as an invited speaker. But I think having those kinds of visitors also use that space will be good for us to community. So, and then as the Ghanaian colorectal fellows come, they can use that space. And as the Ghanaian medical students come, they can use that space. So I think there's potential for different people.
Yeah, I agree. So, and I think it'll be, and those, multiple conference rooms, they certainly can get filled up fast. But as we look ahead and decide, some of our standard meetings, what we want to have, get on the books and start reserving them. Will be important. So
yeah, I think so.
I asked about our administrator as well coming in, and a spot for her, and same kind of thing as how we work that. But they do have some of these open areas or some of the spots that haven't been assigned, so we want to keep an eye on some of those as well.
Yeah, I suspect that probably a lot more of it will not be as used just because of the distance. You're not going to be able to go all the way like a mile down the road in between cases, or if you're taking care of ICU patients or whatever. It's just not practical to be that far away. You might as well be at home.
I mean, Rob Glasgow has an office between me and you, so.
Yeah, there you go. So yeah.
Very how we capture that. The other thing that it does have, downstairs, it has actually a place with treadmill and bicycle kind of stuff. It has a place where you can put your bikes when you ride them in from some other place, and nice open spaces and things. So I think it can be, it'll be interesting. So just a little more update. You may have seen the email just from Nikki. I met with Nikki today, went over the camera equipment things, and I talked with Catherine. Catherine initially thought this big cart would be, nobody wanted it, but actually Nikki already has a spot for that in the new center, and she's made arrangements to have Marcom kind of take a lot of this equipment with the idea that we have access to be able to have them help us with some things. So we're doing some negotiating. So she took some of that today. She'll be back and take more of it later. So
yeah, that's fantastic. Other things, I just got an email from Dr. Scaife in Hofstra. She's one of our surgical oncologists at Huntsman. And she actually has forwarded me and my division chief an email about being a part of the NIHR Global Surgery Unit's most recent multi-institutional study, looking at gallbladder operations. And I'm trying to find the email again. So I was just looking at it, looking at the protocol, and I had said, oh, this is very much of a general surgery thing, but I wonder if it actually would be a useful thing for us to be involved in and help conduct. And basically what these basically how these projects work. And I'm not saying that you necessarily need to be involved, and we can kind of talk to Kimberly and Xavier and kind of see who has faith in their on their plate. But the way these things work is this one starts July of this year, and it goes through November, and has various like 1 week data collection periods. So in that 1 week, can you collect data on all the folks that meet inclusion criteria? Basically, all the people getting gallbladder operations, and it's already like secondary data and de-identified, and then it all gets uploaded into a central REDCap, and they're basically trying to recruit institutions across the world. And it's all just looking at complications of how operations are performed, what are the standards people use, and how what kind of complications result, things like that. And they've run multiple of these sort of multi-country, multi-institutional studies. And actually, some of the people who are running this, I know well, and actually, Ray, you also know well. Justine's a big part of this team. I don't know if she's on this study necessarily, which is part of this group. I actually don't see her on this. Like you and Harrison's on it. And the question is whether we should be part of this or not. We certainly could be, but it's a little bit more related to our domestic practices. So it fits more under general surgery and not global. And so I'm going to see if there is any interest from the general surgery group and from that study coordinator. And it might be worthwhile to have it be a little bit of a collaboration between us. It would start in July, so it would have to kind of get things going quickly, and I can send you the information. You can see what you think about it.
Sure. Happy to look at it.
Yeah, I'll just forward it to you. So there's just various opportunities that we should discuss. And then the other thing is I mentioned to you, Ray, a few weeks ago, I was asked to help write a chapter for one of our major surgical textbooks on global surgery. I haven't gotten any details from them yet, but it's one of our, I think it's Sabiston, I think, not sure. You've written the one for Schwartz already.
Right, yeah, there was Sabiston you mentioned.
And I'm waiting to hear back from them. And so that will be an important project that will be useful to kind of help with drafting a book chapter. We don't have a fellow this year, so it's going to be a little tricky to have hope to draft it, but we can see how we can get it written.
Adele, you got more time in your third year, don't you?
I don't think
yes, exactly.
I mean, that's no problem. You can write a major textbook chapter, right?
For sure, Dr. Price.
But there are, certainly contacts with multiple other people we could work with as well with that too, that would probably be interested in doing that. So we don't have somebody in here, I'm sure that we could find somebody very interested to work on that.
So I think that's something that we'll have to figure out. I don't know the timeline yet. They haven't said anything further, and so my guess is it's not going to be something that's going to be finished in the next, it's letting those take 9-12 months. So I can't imagine that they will that it'll be due before next June at the earliest, I imagine. So
Hopefully not. When we wrote the first one, we've done an additional one, but the first one we wrote, John Hunter called and said, hey, we were really getting close to getting this book together. We decided to add one more chapter. Can you get this to us in the next 2 months?
how it is, right?
So
that's pretty crazy. Yeah, so I think that's something that we're gonna have to figure out how to do, how to organize.
just an FYI, Adrian Park has been approached, and we're thinking about doing a second edition of our Global Surgery, the Essentials book.
Mm-hmm.
So that's another one that potentially could have, as we reach out, we don't know which people would reach out to, but may have some opportunities for some people at the U.
Yeah. Yeah, and my request for the Savston editors was that we need to have co-authors, chapter co-authors from LMICs. So if we have two people from the US, then we need to have 2 people who are not from the US.
Perfect.
And I also asked them what the rules are for having other trainees involved in writing something like that, because could they be listed as author, or what the rules are around it? Because I don't want somebody to work on things and then not get appropriate credit.
The last chapter we did for Schwartz, that was what we said, we'd be happy to do it as long as our fellow can be one of our authors. Exactly. And they said no problem. So we'll see what Savston says.
Yeah, so we'll see how that goes, because we just want to make sure that everybody who's putting in the time and energy will have some way of getting credit for it. So that's sort of, those are sort of some of the main updates.
So with Fidel on the line here, I've got a question for him. Can I ask him a question? Fidel, you there?
Yes, I'm here, Dr. Bryce.
What's ever happened? I mean, they've now done over 200 liver transplants. We were helping them with this paper for the first 100 liver transplants. Where are we with that? And do we have any plans, or what's up with that?
Yeah, I emailed the journal for an extension on the revision timeline. I didn't hear back, and so I forgot to follow through with that. I'll email them again and see what they say, and then is it still? I remember our main point of contact was Sarnai, basically. Is it still her, or should I contact someone else? Do you know?
She should probably be able to tell you who it is, but we had that whole team that was here.
Yeah.
And as to which, it may be one of the other transplant surgeons, as opposed to Sarnai, but you could reach out to Sarnai and ask or one of the surgeons, and because I'm actually not sure right now either.
Yeah, I'll email Dr. Batre and Batsahan. They also were the most involved.
Yeah, I think those were the 2 main ones that I would probably reach out to as well, and they probably would be better at answering the questions than Sarnai, I think, at this point.
Yeah. I'll send them an email.
I think is this a paper that Angel worked on or not, or is it something else? Because Angel just gave all of his projects to Hafsa.
So this is a different one. This is when Fidel started, when he was working. The one that Angel was working on was a different one.
Okay. And Fidel, if there's something that Hafsa can help with while you're clinical, let me know, and it may be Hafsa or Xavier or one of the one of our team. But if it's a matter of this needs to be rewritten, can you help draft whatever it is, then or format it for the journal and write a cover letter. I think we can lean on Hafsa or Xavier for that kind of help.
Thanks. Yeah, that would be pretty helpful, actually.
So just keep me posted on where you are and what you need for that paper. And I know Hafsa and I think Xavier both trying to learn the paper writing, the manuscript writing process, and it'll be good for them to start to see papers in various stages of being written. so they can hope and work on that skill set. And then they can help our team get faster at getting things together. So
sounds good. Will do.
Yeah. So other updates. I've got a couple of different papers that just got submitted. One by one of our undergrads, McKenna, and she just submitted to, I forget the name of the journal. But it's for the pre-hospital related work in Rwanda. And then one of our master's students from Rwanda just submitted a paper to the African Journal of Emergency Medicine, again, because it's pre-hospital related. And she's one of the, I think she's one of the nurses in the pre-hospital system. Yeah, I think she's a nurse there. And then there are two other papers that are in progress with folks in Rwanda. That we have another research resident this year, Dennis from UCLA, who is working on my projects and working on projects with Katrine Gilliard at UCLA, who's their director of global surgery. And so there are a couple of papers that are in progress that need some more finalizing and fine tuning before they can be submitted. Two papers there, and then one paper that Sarah Schoenholz, who was our fellow last year, HAFSA, is finishing up. So there are three other papers there that are in various stages of being written. And this is the hardest part, is getting it finished. Like, starting it is not a problem, and then you get various bits of content, and then you can't get it finished submission. And that's the part where it would be really helpful to have you or Xavier help with. And as you get familiar with these projects, you can contribute a whole lot easier, and you can be a co-author, on all of these, and for whatever that's worth. So if you in your future career want to have more academic exposure or want to have a more academic role, that can be useful. So those are a couple of German projects, and they've all stalled, and I can't seem to push any up the hill because they're all counting on me to be pushed up the hill, and I have too many rocks that I'm pushing up the hill in too many places. But those are other existing projects that are ongoing, and then I've asked Kimberly and Sarah Halburn to help us put together a mini symposium at the end of June for CGS and CMI related trainees projects that are global health innovation and global surgery related projects, not domestic innovation, but explicitly, because there's no home for any of the folks that are working on, low cost warmer in India, or a non-invasive hemoglobin monitor in Nepal, or whatever. All these different projects exist, but there's not a place to showcase them. So I'm hoping that we can do that, especially since we haven't had the Extreme Affordability Conference. But if we can get back into the rhythm of even having an internal showcase, that will be good for those trainees who are able to participate, and then gets us in the routine of having more regular annual showcase that is innovation related. And HAFSA, Fidel, I don't know if you know this, but Dr. Price had led, and Dr. DeVries led many conferences called Extreme Affordability, so based on innovation in global health. And they, I think, starting in
2012, I think was the first one.
Through 2018.
2018.
So. And it was an annual conference. And actually in 2018, it was in Ghana, and I actually went to the one in Ghana. I couldn't ever make it to Salt Lake City despite living in the US, but somehow I could make it to the one in Ghana. But it was really exciting to kind of have this marriage between the innovation folks and the global health folks, and push that, because that's a strength here of the university. And so we need to kind of slowly get back to doing that. And we've kind of talked about how do we organize that on an annual basis. So we're going to start by trying to have a smaller scale one this year, just to kind of bring back our network and have something, you know, even if it's like 20 people, it's not, you know, nothing huge, but it just kind of gets the ball rolling to say, hey, you know, we are interested in this, we're doing this, and let's make this a regular event. And then, you know, we can expand it as much as we want, and have more guest speakers or panels or whatever subsequent years. Ray, any comments on that?
No, it'd be nice to get that really up and going, and really that extreme affordability conferences. Well, it takes about 1.5 years to kind of put that in place. And so, you know, it's something that as we start thinking, we, you know, if we're looking towards next year, it's time to start looking towards doing, you know, the planning process, if that's what we want to do. So.
Yeah, and that's it. You know, that's and to have it do it at a scale, we have to plan ahead of time. So we'll kind of see how this reboot goes, and kind of gets us some motivation to then start setting aside funds and start thinking about, like, how do we want to do this? You know, do we want to do it in a hybrid way, or is there a way that we can have it at, you know, our different partner sites? Like, can we help our you know, Edward Sutherland in West Africa put on a conference, or, you know, can the conference be in, you know, Cambodia or any of our partner sites? You know, is there a way we can put that together? I don't know. Just something that would need to kind of brainstorm and kind of see what that opportunity brings. So that's another update. And then yeah, that's sort of
so little update. I just got this morning the pictures from the 4th lap Coley that they've done from Hawassa since we left.
Oh, great.
And also pictures of them starting their resident training laparoscopic skills program. They sent me a couple of days ago what they had as an outline and which residents were going to be doing it. And so they sent me pictures today of their resident training course yesterday that the faculty is putting on, and they're planning to do this. I think they said let's see, we're starting 2 days a week laparoscopic skills training for the R3 and R4. They've developed a whole schedule for that, and our fellows, the one who set that whole lab up. So that's all of McKinsey's work, and exciting to see that kind of come to fruition. And as we start working on ways to try to write up what's happened there over since 2019 until now, and the model, the American College of Surgeons is trying to work on getting us a list of what universities and who might be going when this year, to try to see if we can reach out and provide some other mentorship with other people going. And so that's hopefully in the process over these next couple months.
Ray, we have to meet with Gurma from ACS and Chris Dodgen
Yep.
MCW next week, I think on Wednesday, about the Wisconsin fellow who will be starting this July and who will be taking over from McKinsey.
Yeah, that's 5 o'clock next week, right?
Yeah, I think next Wednesday.
Okay.
So, and we should see if Anna or Hafsa or Xavier, one of our staff, can be on that call. I don't know if anybody's actually included on that call at the moment.
So that's with at least a little follow-up from the laparoscopic training there, which is actually pretty exciting, and the reports we're getting from there. Mm. The Cambodia work, we have a lot of work to put on. We have a second trip that we're shooting for, hopefully in September sometime, to the CalMet and to Kampong Cham. Kampong Cham has reported over 20 lap colis that they've done since we left there. CalMet, we're working on some advanced skills training. So Picron and Huang have submitted kind of a very basic draft of a day-long kind of outline course that includes didactic and skills. And Jen Woods submitted one for paraesophageal. We're meeting on Monday to kind of look and plan that. The idea is to try to provide some sort of training on those things here this year with, if we get funding for a budget we still have to put together for the second year, to be able to do advanced laparoscopic in-person cases with them next year. So it's kind of in preparation of trying to do that. Also having them during this time, trying to do a 2-day basic skills course, bringing surgeons from the different sites that we're working on expanding laparoscopy to, and having the faculty there really be the ones that put that on. So they've opened sort of opened the new 14-story hospital. They sent us pictures of their integrated laparoscopic operating room. And so they're pretty excited. Things aren't up and functioning quite yet. And so we're getting reports about when that'll happen. We have a meeting tomorrow night with Clayton and with the missionaries in Cambodia to review the budget. So that we can really figure out what we have the ability to do this September. I've reached out to the lawyers here because this last budget cycle technically ends July 31st. When we were there before, we said because of the delays, we pushed this one off to September. So we're trying to write letters and get approval to have that budget pushed back a little bit, and then to update the budget for the next year in the proposal. And so that's something that we may need help with Hafsa and Leif to work on some of these things that we've got to get done over the next couple of weeks.
Yeah.
So that's a little update for Cambodia. Up to Matt's not on right now. Matt is submitting his paper hopefully this next month now. It's the other half of what Sarah had done. Sarah did the treatment portion of the breast cancer. This is the early detection and diagnosis. And that hope to have that one. We just got accepted for quick shots at the American College of Surgeons. Both Matt's paper, I think his was on the pathology in Ghana for breast cancer, or pathology access, and Hell's is on the MIS training program in Cambodia. And there was some discussion whether or not we'll have Leif or Angel present that, as they both worked on it. So we'll figure out where that is at that time. American College of Surgeons is in Boston this year. So at least we have 2 quick shots that have been accepted.
Great. Yeah, there's just a lot going on, but let's see how it goes.
It's very interesting. Just to we've been working on this bilateral equity and surgical exchange programs, and we had met with the State Department, with the ACS, the CUGH, the military, various academic groups, and we're told that they couldn't make really changes to the current J1. Suggests as we look at a couple other kind of visa, but no, we have lawyers that have looked at those, and they just aren't very good ones. It's very interesting. We came across and found actually a 7-page thing from 2016 where the ECFMG and various multiple groups had gotten together to put together a recommendation for a new type of J1 visa. We just got that this week that we're working on and trying to we're not sure why that stopped back in 2016, but we're trying to look at that closely and see if there's some way that we could really work through Congress to get a different visa, and probably just a different type of J1 visa, but it's probably going to have to come through Congress. Our other advocacy component is trying to get $10 million attached to the wording in the to get USAID to put $10 million with the wording that tells them they're supposed to be addressing neglected surgical diseases and health system strengthening through surgery. Chris Stewart is the one who was on the SFOPS committee. Did you see the news? Did you see the news today?
Running from Congress.
So he's retiring.
But is he running for, is he going to run for Mitt Romney's seat?
No, from what I can tell, it sounds like his wife is sick. And so he's probably even by the end of this next week stepping down.
Yeah, I saw that he was going to be announcing that he was going to leave, and that was the news over the last couple of days. Announcement was imminent. It's too bad since he was advocating for surgical funding at Congress, and he's retiring.
It's like, I mean, we were supposed to have a fundraising dinner up in Park City tonight, and that got put on hold because the majority, leader called everybody back to do this vote today, so he had to be back in DC today. But then this came out yesterday. So adapt and overcome. See what we have to work on with that.
Yeah.
We are putting out interest from the ACS Advocacy Committee. Looking for, right now I'm looking on our advocacy committee to see if people are interested, but if not, I'll be looking broader for people who may want to serve on various subcommittees in the Global Health Council and be a member of the advocacy subcommittee at the ACS. So something to think about. We could think if we have any faculty that might be interested, the 3 areas, I'll try to send you the email.
Yeah, now remember, we were going to, starting in July, have this position of the institutional, faculty advocacy person. So I think that would be a prime role for them, but I don't know if we want to announce that sooner rather than later.
And that'd be a good thing to, have that person do as well. So there's 3 different subcommittees we're looking at that have impact, at least from the ACS standpoint, and just an idea of how we get some of the faculty, again, involved on the national level if they're interested in participating in something like that. So,
and I think Hafsa is interested in learning more about that kind of advocacy role, and so maybe she can join you on some of these calls and sort of learn a little bit more about what that looks like.
That'd be great, Hafsa. That'd be, I have a way to do that.
Thank you. Yeah, that sounds interesting. So yeah, I would like to learn more about those things, right?
So,
and if there's any drafting of documents for these congressional committees or whatever, I think that again, would be interesting for Hafsa to kind of learn about that kind of work and just because that's the kind of stuff that we don't actually learn about, right?
Yeah.
Writing policy briefs or things like that, or just stuff that you hear about but you never actually learn about until so I think that's
always in the operating room. And then Hafsa, I know Angel was working, and I went over with him to try to redirect this grant proposal for MIS training. And I think he made some of those changes and went over some of those things with you. And this is the one where they were really asking for developing an open source training program that would allow people to be able to learn laparoscopic information and skills without necessarily having to have mentors come or do it online. Or is there a model that we these days that can have a way that people can actually mentor each other or some other new way? And so that's something that we sometime maybe the next week or so, we should probably sit down and go over where that is and see what we need to do.
So I was just going to help him. Like, he showed me the draft and I suggested him few things to change in there, and he was supposed to do that. And I was going to help him with the budget part. And I gave him a little draft, like these are the things he needs to find out before we finalize the budget. But I never heard back from him because I think he was supposed to connect with you to find out like the amount and all that stuff. So I'm not sure where that is actually. And I think Leaf is going to take over the whole thing. And I'm happy to help wherever you need it, but I think Leaf will be the
At
main
least
person.
he's going to help to take over. Again, I think Leaf can do some of that. I think he's still
Yeah.
fairly young in that kind of thing.
I'm
So,
happy to do, yeah.
so
wherever you-
somehow we just probably ought to set up a time, and maybe even sometime next Wednesday,
Okay,
to just review where we are with that, with
Sure.
you, me, and Leaf, and see if it's something we want to continue to look at or what we want to do. All right, so maybe we can look at what, maybe we can check with Leaf and see when he's available based
Okay.
on schedule stuff. So hopefully we'll be back to doing some Ghana meetings at 11 and a Cambodia one at noon, but other than that, I think should be available.
Okay.
Yeah, I think that would be good. I'm happy to try to attend as well. What am I doing next Wednesday? I don't even know what my schedule is. Yeah.
Do you even know where you're living?
I do know where I'm living, and sometimes that is a question. But next
Okay.
Wednesday, I'm actually wide open all day, so I'm happy to participate and kind of strategize where that goes. If we should make sure that Leaf should, I don't know what his work schedule is over the summer.
Right, that's what, find out. We can just leave, or if you can find out from Leaf Hasta and then kind of let us know. I'm going to plan to be up there earlier to kind of go over still some of the stuff to pack up in things for the center.
Yeah.
And now that I know what's available, they said they're going to deliver these boxes to us to pack up potentially on the 9th.
Next Monday, I thought.
Yeah, Stacy said it was the 9th, but maybe they'll come sooner. And that they would move them somewhere like the 20th or something.
I'm hoping to just get some regular boxes from downstairs in the basement and just pack my stuff. And that way I don't have to worry about it, because the date keeps moving of what is going to happen.
Yeah.
So.
But they have specific, size boxes that they're allowing. So it's an interesting time.
Yeah. Ray, I'm going to just send an email to the four of us about meeting next week about that grant.
Okay.
And so can you confirm what times you're available next Wednesday?
Like I say, I'm available except for that. Well, I guess I do have a dentist cleaning from 8 to 9. So I could be available from 9:30 to 11 or from 1 to 5.
How about 9:30 to 11?
Yeah.
That way, we all have it on our radar. And then Hafsa, will you plan on just pulling up the emails that you had sent, the questions that you had, and then we'll go through the application. We'll see what the budget looks like. We'll figure out when we're going to need to submit it. Will you also look at the deadline? I don't know if it's a rolling deadline or if there's.
I think he was saying it was a rolling deadline, and we just met over Zoom and I kind of went over the things I think he should change in there. I would look in my email if I send him an email with those points, but I'm not sure. But I do have the application he sent me, so we can go over that.
So let's just go over it and then we'll see how we can finalize it.
Okay.
Yeah, if you just read that again very carefully,
Yeah, I will do that.
What they're asking for, because
Yeah.
he was.
He did a pretty good job, but like there were a few things here and there. I was like thinking like.
Yeah, there's some things I said had to point out a little different focus than what they're asking for.
Right,
I think he's made some changes since then.
Oh,
So.
okay.
Yeah.
Okay.
Okay. Other things. Rachel is heading to Colombia this next Monday for about 2 weeks to work on a trauma and vascular, not transplant, partnership, and see how that could be worked out. But it seems quite complicated, so I don't know if that will work out or not. So that's another experience for her. She's spent a lot of time in the African setting. Does not spend as much time in the Latin American setting. So I think just having that exposure and helping us figure out if we can actually create a partnership that makes sense will be a useful question, and we can have her, when she comes back, give us an update on what her experience is like and what the issues would be for us to be engaged there. So.
Yeah, one of the things that would be nice in this meeting at the end of the month is if we can reach out to the faculty that are involved with these Gardner Holt grants. Certainly would be nice to get an update from the various people that are engaged with that, where those are.
Yeah, I think that I think that's a great idea, is to see if we can have presentations, like final round presentations, or like final presentations from last year's grant awardees.
Yeah.
I think that would be great. Or we could also have them just do it during like works in progress periodically in the next couple of months, just in terms of like availability and things like that, you know, and so we can give them more dedicated time, so that, you know, a half an hour presentation and then discussion, as opposed to like a 5-10 minute talk. So yeah, I think you're right, and we're going to slowly put together a report as well that Xavier's been working on, to try to see if we can summarize what we've done with those funds and what progress has been made. Ray, we should see if we can get summaries of Matt and Sarah's papers to put in there as well.
Yeah, absolutely.
So we should figure out, but I guess if we can get those papers, and if you can send me those papers, then I'll have Xavier pull that information to put it in that report.
The paper that Sarah submitted.
Mm-hmm.
Okay, do we want to put those in? And Matt's is another faculty person reviewing that this week. So do we want to wait till we get the one that they've submitted? So as soon as they submit it, do you want it, or what do you want? The title? Do you want the?
Yeah, or I think probably submitted version, I guess, would be probably as close as possible. So just so we can take the content and try to make it into a little bit of a report.
Yeah.
Xavier is working with our scientific editor in the department to try to put it together. So
okay.
Content.
Good.
So as long as they're not like, I mean, they're not going to take, there are going to be some changes, I'm sure, that editors will require, you know.
Right, that's what I'm wondering, because even with Sarah's, you know, that's a behemoth of paper that I'm sure we're going to get some comments back.
Yeah, but I'm sure in the reports we can just ask for more summarized, like here's what was found, more generally. Right. I'm sure some of the results aren't going to change. It's just a matter of kind of how are you interpreting this or that, or that kind of clarification.
So you're looking at Xavier to kind of put a summary in there and not the paper itself.
Yeah.
Okay, got it. Okay, that makes me feel better. Yeah, because if we can come up with a summary kind of thing, that's great.
So that Xavier, I asked Xavier, tasked him with putting together a report based on last year's Gardner Holt grant awardees, their projects, and who we're supporting this year, and then the countrywide cancer papers, and put it all together in a report of here are the different projects that were supported, that were done with these funds, and here's what we've accomplished, and here's our next step.
You know, some of that I was talking to Nikki today, some of those things she says, you know, she's having to revamp the entire web thing for the department, which is about 1,000 different pages. But she also, I pointed out to her that ours is like way out of date. She said if she could look at it and, you know, to show her the stuff that's out of date, she'd get rid of that stuff real fast. And if we had just some short little stories, she'd be happy to get them up there and the way we, you know, where they go. And I talked to Catherine today. She was going to take a look at the website and kind of see what's out of date.
I emailed you and Catherine about this about 2 months ago after I met with Nikki.
Oh, good. So.
Because she gave me like the link to upload information or upload, correct information, so that she has everything that she can then change and post.
Yeah.
But it's a little bit of a process, and I have not gotten to putting out the.
No, none of us have. So.
And I know I've asked Hafsa and Anna and Xavier to work on some parts of things to gather information. Like the research stuff is pretty up to date. Anna's working on the education stuff. All of our programs we need to update and connect to the right divisions. And you know, that's just going to take a step at a time. And I don't know, Hafsa, if it makes sense to just look at each division on a weekly basis and see what are we doing here, what content can we put up there, or something along those lines, so that we can slowly make progress on it. Because like looking at all of it is kind of overwhelming. So I wonder if we should come up with a strategy like that just says, you know, as a group, let's just take a look at the work that is happening in X division, and how do we feature that. And yeah, so I think that's also something we could tie into the surgical department newsletter too. You know, we have so much going on, and yet like we never submit anything to the department newsletter because there's just too much going on to be able to summarize any of it in a meaningful way. But yeah, I think we have to kind of figure out how to do that, because there's lots of great things that are happening, right? So, you know, like there's stuff happening in Rwanda, Cambodia, and Ethiopia, and you know, at Congress, and like, you know, there's literally enough material for multiple newsletters. But you have to. The best way to be organized about it is harder to answer. Anyway.
All right. Well,
it was good catching up in general about many different projects that we'll keep working. And the other thing is we need to figure out the timing for this, and whether we want to keep it on Mondays and Wednesdays, noon and 3 p.m., or if we want to spread it out more. I don't know if it makes sense to have it. It doesn't make sense to have it weekly. It doesn't make sense to have it every other week, and have a speaker. I don't know. I just have to, and then what to do about over the summer, because as more people are traveling, it's harder to have more things. I don't know.
And like you say, nice to find a way that we can get something more, you know, better time for some of the faculty. Maybe there's not a good time for any of them, but you know.
Yeah. And there are definitely people who come, like Brad Rockwell comes on Mondays quite often.
Good.
Sarah Droyet has come from ENT, and folks from you know, neuro want to come and speak. So there's definitely a lot of interest, and especially if we have presentations. I think internally we have to kind of figure out how we're going to keep track of the different projects a little bit more. And maybe that's what we do. We just have these internal meetings and we just go through the projects a little bit more. So we have to think about how to do that.
All right. Well, I got to go talk to a guy about tearing down my decks and building back up, and I don't like the budget.